all the beneficiaries under our care. For those who have not donated,
residents. It enables them. Thank you for your support.
Thank you, Minister. I believe today's event has been a meaningful experience for all of us, and on behalf of the Salvation Army, we'd like to thank our distinguished guests and everyone who has donated generously to support our cause. As you can see on screen, you have helped to raise over $178,000 this evening, which is closer to our goal of $225,000. Your support means a lot to the Salvation Army and to all the beneficiaries under our care. For those who have not donated, it is not too late. You can still show your support by scanning the PayNow QR code with your mobile banking app or by donating via the available donation link. So once again, thank you everyone for your support and have a good night. Thank you.
People to give is now conducted.
Do remember to donate to join the Salvation Army in making a difference today. To donate, you can scan the PayNow QR code with your mobile banking app or click on the available donation link. Wow! I'm encouraged to see the amount raised is now over $136,000. Thank you for your generosity, and do keep giving so we can reach our goal of $225,000. Now, I have the pleasure of introducing our guest of honor, Mr. Desmond Lee, Minister in charge of Social Services Integration. We are honored to have him with us today for the speech.
Good evening, everyone. It is my pleasure to be part of the Salvation Army's Red Shield event today. The fundraiser is now conducted online, and all of us can get to know more about your positive impact on the community. To manage the social and economic fallout of COVID-19, the government has rolled out various measures to help individuals and families, such as the COVID-19 support grant. Low-income and vulnerable households are especially at risk. Needs may also continue to grow as the economic slowdown persists. But when we work together across the government, social service agencies and charities, we can achieve much more collectively. Your support and contributions ensure that those who need support receive it. The Peers Network is a good example of private and public partnership. It stands for Partners in Engaging and Empowering Rough Sleepers. The Salvation Army, with other government agencies, community groups, and social service agencies, was an early member of this network. We created an ecosystem of care for rough sleepers, providing them with shelter and support, and helping them move off the streets when they are ready. During the circuit breaker, we saw an increase in the number of people seeking shelter. It was of paramount importance to ensure their health and well-being during the pandemic. The Peers Network stepped up their efforts. Together with other existing members, we worked with new partners who came forward, some 40 community-based organizations, to assist over
Christ.
Isolate everyone.
Above it,
the Salvation Army's residential home for children and young people.
Now, Augustine, during the circuit breakup, now we know that residential programs were permitted to continue providing services. I'm sure safety was a high priority. So how did your home keep your residents safe?
At The Haven, we followed the necessary guidelines and provided briefings for staffs and residents to understand the measures to keep the home a safe environment for everyone. Residents and staff were also grouped in split zones, and all activities were conducted within the respective zones.
Thank you, Augustine. Now, it is good to know the efforts that were taken to keep all residents and staff safe. Now, let's see where the lights stop next. With Muilan, Executive Director from Peace Haven.
Hello, James. Thank you for having me here today.
Hi, Muilan. Do share with us your biggest concern during the circuit breaker and how did Peace Haven address it?
One of Peace Haven nursing home biggest concerns was the residents' welfare, as many of them felt cooped up. For those living with dementia, they simply could not understand what was happening. To reduce their anxiety, we also organized activities to keep them meaningfully occupied and make them special meals to keep them happy. When visitation was not allowed, we used video calls so that our residents could continue to interact with their family members.
I'm sure the residents appreciate Peacehaven's efforts in keeping them safe and well cared for. Through your team's efforts, Peacehaven has managed to keep the virus at bay, and so has all the other social centers under the Salvation Army. Kudos to everyone! Let me press the buzzer now to speak to Yvonne. Yvonne, tell us all about yourself.
Hello everyone, my name is Yvonne. I am the Center Manager from Family Support Services.
So, Yvonne, now as a community-based center in Bukit Merah Estate, how did your team help the vulnerable during the circuit breakup?
To ensure that our clients do not feel neglected, our social worker at Family Support Services call our client regularly and check in on their health and mental well-being. As you know, James, many of our elderly clients live alone, and the social interaction over the phone reassures them that they have not been forgotten. We also send them supermarket vouchers as our food ration distribution drive was suspended during the circuit breaker.
Thank you, Yvonne. Now, it's good to know that Salvation Army continue to reach out to the needy and elderly living alone in the community. Hey, I hear Colonel Rodney's footsteps at the corner. Let's hear more from our Territorial Commander about the Salvation Army's efforts during these challenging times.
Thanks, James. A very good evening to all our distinguished guests for joining us today. Thank you for giving us the opportunity to share about the Salvation Army's work during these unprecedented times. COVID-19 has brought a lot of uncertainties to everyone. In times like this, it is the most vulnerable groups who are the worst hit. In many families, the breadwinners have been laid off or asked to go on unpaid leave. Our beneficiaries are worried about feeding their families and paying the bills. We're also very concerned for some of them who may despair and sink deeper into hopelessness. During this pressing time of need, the Salvation Army has been helping many vulnerable groups, from the young to the elderly, by providing essential services and meaningful programs. We remain committed to be a beacon of hope to the underprivileged because our love of Christ compels us to extend His love and compassion to all. During circuit breaker, the government only permitted essential services to continue operations. While we were glad to continue residential programs, we were stretched in our resources at Peacehaven, Gracehaven and The Haven. We were glad that many kind-hearted donors and partners came along to donate masks, food supplies, laptops, and even assist in e-volunteering. With their support, we were able to focus on taking care of the residents' health and safety. Thankfully, with the dedication and effort of our staff, COVID-19 was kept at bay from all our social centres. Besides our residential programs, our team at Sojourn also worked tirelessly to support the needs of migrant workers during these challenging times. We provided care packs and emotional support, as many of them were worried about contracting COVID-19 and losing their income. Later on, Sojourn, Carehaven and other social centres will share more about the outreach efforts to care for the vulnerable and underprivileged in the community. The